Good morning, Los Angeles, and welcome to Lincoln Park, where we're here at the Recreation Center together with Chief Ralph Terrazas of our Los Angeles Fire Department and some other critical guests who have been playing an amazing role in our fight against COVID-19. And I want to thank Chief Terrazas for his great work and the work of Los Angeles Fire Department in administering the first COVID-19 vaccines for city personnel earlier this week. The first dose was given to half of our battalions this week. Next week we'll get the second half of all of our battalions as well. And today we're here at the Lincoln Park Rec Center, which is one of 3 city-run sites where starting today we're going to expand our vaccinations, not just to our own personnel of the fire department, but also to our incredible healthcare workers who will be vaccinated for COVID-19 in a way that we're helping the county out as part of the ongoing task force to make sure that Los Angeles is vaccinated. It was just about a week and a half ago that the Moderna vaccine was authorized, approved by the FDA for emergency use. And a few days later, the Los Angeles County Department of Public Health provided the city with 2,000 doses for the first phase of vaccinations for healthcare workers. And across 3 different sites in the city of Los Angeles starting today, we're going to be administering about 300 doses to our healthcare workers, especially in those hard-hit neighborhoods where we see community spread, where we need them to be able to show up to work, where we need their families to be safe, and where we want to make sure we slow the spread of this virus. If it sounds like we're moving quickly, it's because we are. We cannot move quickly enough when it comes to COVID. There's simply no time to spare with this virus raging in our city, and with Los Angeles being in many ways ground zero in this nation right now for COVID-19 propagation. There's nobody more vulnerable than the men and women who have been shift after shift, going on very little sleep, coming to our hospitals. Our eldest is a nurse at Cedars-Sinai, and I've talked to her every single day. It was just a week and a half ago where they had 200 patients, and they're expecting to have 400. 2 floors that were COVID, now 8 just for COVID patients. This is real, and this is overwhelming our healthcare workers, and we need to make sure that they are at the front of the line and that they have opportunities close to where they live to get vaccinated. So before I say more, I want to acknowledge the partners in this effort. And this is very hallowed ground in this fight, because it was here in Lincoln Park that we first came together with one of our partners, or 2 of our partners really, with CORE, which was our healthcare volunteer partner from the beginning. When they came to us with this crazy idea of another testing site, we had no idea that that would become not only a model for all of Los Angeles, but for this nation, for how we could come together with government, through our firefighters, volunteers, through CORE, and through a great company, Curative, locally based, that was stepping up and able to match the need that we had for testing. And so together, those 3 pillars, and the 4th pillar, USC, which has been representative of so many amazing healthcare providers, but USC School of Pharmacy, Curative, and Carbon Health, all 3 of those healthcare providers and healthcare involved entities have been a huge part of this, and I want to thank USC School of Pharmacy that's helped us with flu vaccines, now will be helping us with these vaccinations for COVID-19 as well. As I mentioned, this is one of 3 locations. The other 2, one is in South Los Angeles at Crenshaw Christian Center, and the other is at San Fernando Park, where we also have a walk-up testing center. So it's right there in the community. We know the Northeast San Fernando Valley has been among the hardest hit, so is South Los Angeles, and so here too on the east side. So we'll be opening also a 4th vaccination site for healthcare workers at Hanson Dam on January 1st, so just in a few days as well. And these sites were built out of the robust testing centers that we built up throughout the county, which I still think are the finest in the country. Over 3 million tests have been administered free of charge to folks with and without symptoms, and no doubt saved thousands of lives. And we continue to encourage people to know your status. If you feel that you've been exposed or have any symptoms, get tested, isolate if you have positive, quarantine if you've been exposed. My own family just went through that recently, and it is critical for us to know that, to be able to slow right now this spread, which is overwhelming our healthcare system. So thank you all for being here. We know that vaccines are the next critical step in everything that we are doing. We've got a lot of reasons to be hopeful for 2021, but we've got to buckle down and know that the first few months of 2021 are going to be as tough as anything we saw in 2020. We can't let good news about vaccines cloud our judgment of what we need to do, because right now the spread of this in the community is so widespread, it's no longer about what's open and closed, it's about what we do individually. It's about wearing a mask indoors if you have somebody in your family who's been exposed, especially if you're living in a dense setting. It's about making sure that you don't continue to go out. And absolutely, it's about staying home for New Year's. There is no reason that anybody should be out and celebrating New Year's. We need to be safe and give the gift of 2021 of people still being alive. We know that those actions will kill people, and I hate to be so extreme about it, but we had a record number of deaths in California, and a person is dying every 3 minutes in California from COVID right now. So let's take this seriously. Don't let your guard down. Keep your physical distance. Wear your masks. Make sure you wash your hands for at least 20 seconds. As I said, everybody's doing so much, but each one of us can still do more, and please do. So we're offering still, I want to say one last thing, the 46,000 free tests a day. If you need a test, as always, go to our city's website at coronavirus.lacity.org/testing. And as I said, to put it simply, we wouldn't have had this incredible testing system and program in Los Angeles if it wasn't for CORE and its 500 volunteers. I hope you've heard me appeal to you to donate to CORE enough times. It is an amazing organization. It did amazing work from LA in the world. Now it's doing amazing work for the world in LA. And just at Dodger Stadium alone yesterday, our largest testing site, and still probably the largest in the country, if not in the world, 10,700 people were tested. So I want to thank Ann Lee and her co-founder, who I'm going to ask to come forward now, Sean Penn. Hold on one sec, we'll spray it down. You never know with
man. Thank you, Mayor. Thank you for your leadership, your faith in CORE. As the Mayor mentioned, this is at this point a very limited rollout specifically intended for healthcare workers. While it's not a public vaccinations site, we are continuing to work with the Mayor's office and LA County Public Health to support efforts for a wider rollout of the vaccine, and in hopes to bring it to scale as we were able to do collaboratively with testing. Today, it's essential that we provide vaccinations to our healthcare workers who've been tirelessly serving on the front lines. These heroes must be protected so they can do their jobs safely and to keep their own families and communities safe. Our key goal is ensuring equitable distribution of the vaccine, just as we have made that a priority for testing with our partners across the country. We're also focused on providing information and educational resources to high-risk, low-income, and communities of color. Testing will be still an important priority over the coming months until the vaccine is fully rolled out. We will not be losing sight of that. Together, CORE, the City of Los Angeles, Mayor Garcetti's office, LAFD, and the Curative Lab have tested more than 3.2 million since launching public testing sites in March. Today, with our partners, we have the capacity to test 46,000 people across the City of Los Angeles each day. The partnership between CORE, LA Mayor Garcetti's office, Curative, and LAFD showed how the public, private, and nonprofit sectors can work collaboratively to serve the public during the biggest challenge of our times. CORE's tireless staff are working around the clock to provide accessible and free testing and eventually vaccines to all who need it. We are committed to meet the demands of our community. Our testing sites are staffed by more than 775 volunteers and staff, just regular people from Los Angeles who have stepped up to help us accomplish our critical mission. Please visit coreresponse.org to learn more about CORE's COVID-19 response. Thank you. Thank you to all. And Chief Terrazas.
Spray it twice. I'll give you a long intro, but go for it.
Thank you. Thank you, Mayor. Thank you, Sean. I just came from Fire Station 4 where I got the shot, and the firefighters are very excited. They can see the light at the end of the tunnel. It's actually palpable, and a lot of our firefighters have elderly parents, people with underlying health conditions at home. So I'm inspired that our people are doing it. And as of today, and we just started Monday, we have 1,000 of our firefighters who have taken the vaccine. The men and women of the LAFD have been on the front lines of the fight against COVID since the pandemic began back in March. Today, we are here because we are again answering the call to assist. We are joining our partners at CORE, Curative, Carbon Health, USC, and the LA County Department of Public Health to expand the COVID vaccination program to a wider group of healthcare workers. Working with our partners, the LAFD has developed a world-class system to organize and operate COVID testing sites, which to date has tested over 3.2 million people. This is a mission we were first given back in March, and we've continued to refine our operations so that we can keep up with the constantly evolving situation. Today we move into the newest phase of our ongoing battle with COVID. By next week, we will have the ability to provide healthcare worker vaccinations at 4 of our 15 LA City testing sites. And we will begin providing vaccinations to 22 skilled nursing facilities within the city of Los Angeles, which totals approximately 7,000 residents and staff. The Los Angeles City Fire Department is ready, willing, and able to assist the county with additional help if called upon. The vaccine is the most critical tool we have in the battle against COVID-19. And the LAFD is proud to be on the front lines as we protect our healthcare workers, our communities, and the people that we serve. Thank you very much.
Thank you. And next I'd like to ask Dean Vasilios Papadopoulos of the USC School of Pharmacy, who, as I mentioned, has partnered with us to provide nearly 15,000 free flu shots at the same time that we were doing testing. We're so fortunate to have them on board for this vaccination effort. Dean.
Thank you. Off script is really amazing to see around us media, politicians, academics, clinicians, entertainment industry, the community. This is the community. And this is quite rare, but I think these times require this effort, such an effort, to solve a problem for all our safety, all our health. So thank you, Mayor Garcetti, and again, today is a very important day in the fight against COVID-19, as the vaccine is distributed to healthcare workers in our community. The USC School of Pharmacy is glad to collaborate with the Mayor's Office, Los Angeles, the City, LA Fire Department, CORE, Curative, LA County Department of Public Health, as we expand upon our flu vaccine efforts over the last few months and now begin to provide the COVID-19 vaccinations. I want to thank Dr. Richard Dung, Carla Blyden, Rafi Svajian, and our entire School of Pharmacy community for their tireless efforts to make today a reality. Pharmacists play an essential role in the response to COVID-19 pandemic, especially when it comes to vaccinations. And our faculty, staff, and students from our school are here today providing the COVID-19 vaccine to frontline healthcare workers. The vaccine will become available in phases and tiers over the next few weeks and coming months. I urge everyone, when it is your turn, to get vaccinated. Soon you will be able to get the COVID-19 vaccine at an event like this one, at a neighborhood pharmacy in your community and other locations. Getting the vaccine is safe, quick, and effective. It's about protecting your life, the life of your loved ones, and the health of your community. The COVID-19 vaccine is an important tool in our fight to bring an end to this pandemic. Please spread the word. Get your COVID-19 vaccine when available to you, and stay safe and healthy. Thank you.
Next, I want to introduce the CEO of Curative, the company I mentioned, Fred Turner, who's been a great friend. Los Angeles, we've had 1 or 2 moments where we've had a few day delay, and that's as we were developing and growing this testing regime. But besides those, literally handful of days, Curative has been a partner unmatched in this country, able to turn around our tests in 24 to 36 hours consistently, whether it was when we were doing 500 tests or whether when we're doing close to 50,000 tests. And I just want to say on a personal note to Curative technicians who I know are working sometimes, I don't know if they're windowless rooms, I imagine them sometimes be windowless or full of windows, who knows, but they are slogging away hour after hour after hour to make sure when you get that email and you can find out your status, that you get it done quickly. And it's really exceptional. Those are folks who've worked through holidays, who work around the clock at night. And we praise our healthcare workers as we should, but the laboratory technicians and the people behind doing this are also just as worthy of our praise. So I want to thank them from the entire city on behalf of 4 million souls, 10 million that we are testing for, and thank you, Fred, for your great work, and invite you forward.
Thank you, and thank you for thanking the lab workers. I think sometimes the people in the lab, kind of behind the scenes, running the testing, they're not seen, but we had a full staff of people in on Christmas Day, Thanksgiving Day, and they'll be there on New Year's Day as well, to make sure we can continue supporting testing across LA with a rapid turnaround time. We're really thankful to our partners at LA City, in CORE, and in LAFD for what we've been able to achieve with testing. From a single test site at the beginning of the year doing just a few hundred tests per day, now scaling to over 3.2 million tests completed with a capacity for up to 46,000 tests per day. I think that the scale has really only been achieved through that partnership between the different organizations there. We've gone from just that single testing site to now multiple different modes of testing, from Dodger Stadium doing over 10,000 tests per day at a single location, by far the biggest in the country, to the kiosk at Union Station and mobile vans and the mobile team that are out there getting tests to where they need to be in the community. We're dedicated to keeping scaling testing as much as is needed to meet the demands of the community. We're very hopeful that the vaccine will help us get this pandemic under control and reduce the ultimate need for testing. But right now there's going to be continued need for testing, and we're going to be there to meet that demand. We're very excited to be partnering, continuing to partner with the city, with CORE, and with LAFD on the next phase of the pandemic, which is the rollout of vaccinations. Initially, as you've heard, this is just going to be at the 3 sites, but we're excited to take the lessons that have been learned from testing and scaling that up faster than anywhere in the country, and helping to apply those to vaccinations as well. The goal, obviously, being to vaccinate as many people in the long term as possible and end the pandemic as quickly as we can. As part of curative scaling to do over 11.5 million tests total, we've hired over 1,000 people in California who work tirelessly to make the testing possible. If you're interested in working with us to help end COVID-19, we are hiring. Please reach out to us. We are hiring at curative.com. We're always in need of great people to work with us to help end this pandemic. I want to end by thanking again all the partners who have made this possible with us to get to this point. Thank you.
And finally, I'd like to ask Dr. Carla Blyden to come forward, also of the USC School of Pharmacy. She's been instrumental in our flu vaccination program and vaccinating on the front lines at our flu clinics, and has been a really critical partner. So thank you so much, Dr. Blyden.
Hi, thank you so much, Mayor. As a pharmacist, I can tell you that we are confident in the science of these vaccines. The vaccine is effective, and it's necessary to keep our communities safe and to slow the spread. We've been outside providing the flu vaccine for the last 3 months alongside the COVID testing sites, and we are excited to now shift these efforts to the COVID vaccines. The USC School of Pharmacy is also excited to be here with our community, supporting our community, working alongside the city with CORE and Curative, and with the support of Keck Medicine of USC. Thank you.
Thank you, Dr. Blyden. Finalmente, también en español, yo quiero decir unas palabras. Hoy estamos aquí en el Centro de Recreo de Lincoln Park, uno de los 3 sitios donde nuestros increíbles trabajadores de salud recibirán sus vacunas contra el COVID-19, empezando hoy. Cada uno de estos sitios tendrá capacidad para administrar unas 300 dosis al día a las personas quienes están trabajando en nuestros hospitales y salas de urgencias, luchando para salvar vidas. Estos sitios diseñaron como una extensión del programa de pruebas gratuitas que lanzamos en marzo con nuestros colegas de CORE, del Departamento de Bomberos, de USC y de Curative, la compañía de las pruebas. Hasta hoy hemos administrado más de 3 millones de pruebas en Los Ángeles y vacunamos a casi 15,000 personas contra la gripe también. La ciudad, el condado y todos nuestros socios harán todo lo posible para vacunar de manera equitativa, segura y rápida a tantos angelinos como sea posible. Mientras tanto, tenemos que seguir enfocados en protegernos. Otra vez, por favor, continúe manteniendo la distancia física de las personas que no están en su hogar. Quédese en casa todo lo que pueda y siempre use una mascarilla cuando salga. Y sepa que siempre puede hacerse una prueba. Para hacer una cita en uno de nuestros 10 sitios en la ciudad, por favor visite coronavirus.lacity.org/testing. Muchísimas gracias. With that, happy to answer questions.
Sure. Good morning, Mayor.
Good morning.
Steve Gregory, KFI, on
See you,
behalf
Steve.
of the LA Press Corps. Thank you. First question, and some of these questions have been combined. They're all very
Sure.
similar in nature. So,
Yeah.
so how many other sites will you do for vaccines? I know you're doing, you said the 3 now.
Yep.
Is there a plan to expand this to where that every testing site will be a vaccine site?
We're preparing for that. We follow the direction of the state and the county, and we are here to help them. This was a place where we quickly saw many medical workers are able to get vaccinated at the big hospitals and some of the places with more capacity. But we've got medical workers in clinics and other places where that just isn't available. So that's why we set this up to kind of build that up. So we're calling these pods. It's not a pod in the sense that they're a household, but these are places where not open yet to the public. We hope that will be down the line. We're taking the most vulnerable frontline workers and giving them, but we'll build that capacity at each one of the testing sites, and we're ready to press go on that. The LAFD has been preparing for that, and we sit on the county task force. So when we go to 1B, when we go to general public, absolutely, these are places where we hope to make up for folks who can't get vaccinated at their medical providers.
So is this the Pfizer vaccine? And if so, how are the logistics being worked out for the 3 weeks?
No, this is the Moderna one.
This is Moderna?
Yeah,
okay.
this is Moderna.
So this is the one-off?
Exactly.
Okay.
Moderna is still a 2. It's the AstraZeneca that's a 1. Oh, sorry, Johnson Johnson's a 1-off. This is 2, and this is 21 days. 28. Pfizer is 21 days later. Got it mixed up. And this is 28 days. Folks will have to come back and get the second.
So they
dose.
have to sort of keep track of their own calendar and come back to the same site, or can they go to any of the other sites?
They can go to another site, but
Okay.
we have their information, and we'll make sure we stay close to them. But the idea is close to where they live, so they'll most likely come back here.
Okay, this one comes from Claudia Piscuta at KNX. Given what's been described as a truly dire situation for local hospitals, do you think tougher restrictions are needed to slow the spread of the virus? And isn't it time to go from encouragement to enforcement?
Well, we do enforce, and we'll continue to enforce. I want to be very clear. We don't have the capacity to enforce on 4 million people, let alone 10 million in the county, for every person who ever violates anything. But we go to those places where we see businesses that continue to violate, obviously things like the underground parties, when we break those up, turn off their power, and folks that willingly, folks, for instance, think that we've never enforced on things like masks, where people consciously go in the face of somebody saying you can't be in my business without a mask on. We have absolutely backed up those businesses and enforced. So we enforce wherever we can. We encourage first. It's not an either or. A lot of people, sometimes it's somebody who doesn't have, because of their low income status, ability to get masks for all their kids or things. So we try to provide, we try to encourage, educate, and we do enforce, and will continue to. To the first part of the question, should we go to deeper restrictions? I've been supportive of anything that our public health department recommends on that. I don't follow it blindly. I assess it. And certainly around the edges, the tightening up is something that we needed to do a few weeks ago, and I would certainly support it if there's further tightening up. But it's pretty clear now, the overwhelming majority of this, I don't want to put a number on it, but 80-90% of this is community spread, which is not coming from what is open and not, or from those places we will never close, like a grocery store. There's so much spread now that is a higher risk thing. That's why I'm encouraging people, stay home. We can't close grocery stores. People couldn't eat if we did that. But that doesn't mean everybody needs to go to a grocery store. Use a delivery service if you can. Buy more when you're there and go less frequently. These few weeks will be critical.
Claudia's follow-up, do you support shutting down film and TV productions right now?
No, I know that's been a flashpoint, as if that's something where people have, that they've got more lobbying juice or something. No, industries, whether it's construction, which nobody I think thinks has a big lobbyist, or Hollywood, where you can contain a workforce, inspect that. That's a different context, and I'll follow public health advice on that. And public health advice has been that is not a place where we're seeing spread, precisely because it's the same people coming back to that set, rigorously tested, and that is a much more controllable space. Places that are open to the general public are not So that's why certain things are closed and those continue to be open. But if they recommend that, I would support it. But I have not seen any evidence that that is not something necessary to shut down.
Okay, this one comes from Mo Kelly. After Phase 1A, how will vaccines get to the most vulnerable populations, at-need communities, and who decides who are those types of communities?
So we're following the federal guidance on this. Some states have rejected that, but we are following that from the CDC. With Phase 1A, it's people who are at risk of exposure to SARS-CoV-2 through their work in any role of direct health care or long care settings, including persons at direct risk of exposure in their non-clinical roles. It's also residents of skilled nursing facilities. As you know, we've rolled that out and we're already underway giving vaccines to employees and residents of our skilled nursing facilities, our assisted living centers, and similar long-term care centers where we've still seen the majority or about half of the deaths to date came from those areas. In Phase 1B, we'll be turning then to essential workers and those who are over 75. So there is a county task force on this. We sit on it, but we will phase depending on the more quickly we get these out, the more we're told we'll get in. So the quicker we can vaccinate people, the more vaccines Los Angeles can access. If we're sitting on ones that we're not moving quickly, we can't replenish that. We can't just say next week we're going to have 10,000 people. They say you still have 2,000 you haven't done. We got to get down to zero as quickly as possible every single week. And so that's the idea here with our firefighters, and Phase B, the essential workers and those over 75 and healthcare workers who are not vaccinated in 1A will be the priority, and we'll follow the county's direction on that.
So if that's the case, then if you had more places to administer the vaccine and more labor to do so, we could get this done faster? We're
confident right now that we can get them done as quickly as they come in, and we have enough sites for that. But certainly we're ready to scale that up. If we're right now, I read a depressing statistic today that the 2 million vaccines, and some say that's an undercount, maybe let's double it and say it's 4 million. If it was 2 million in these last 2 weeks, this is a 10-year timeline at this pace to vaccinate the United States of America. If you double that, it's 5 years. So we obviously have to double and double and double again, just as we did with testing the capacity. We're ready to do that today. We just need the green light.
The question could be targeted to Chief Terrazas, and I don't know if you want to answer that, but I was going to ask, since the LAFD paramedics have been now authorized to administer vaccines, there might be a plan to use them for mobile vaccinations?
Alex, can I get this spray?
And I think, you know, Chief, so going out to those communities that might not be able to get to these sites, is that a plan?
Yes, it is, Steve. 3 months ago, we asked for approval to allow our medics to increase their scope of practice so they could administer the shot. We put out a notice to the field about a week ago, and on Monday we had about 200 medics trained up. We have 1,000 medics on the LAFD, so we do have that capability. We've been leaning forward every step of the way with the expectation at some point that we would be providing these vaccines at these 15 sites that currently exist. And we also have a mobile testing capacity which can be converted to mobile vaccinations, and that's where the medics will come in.
So presumably, as you roll more and more of your people out to do this kind of task, the faster we can get this out into the community?
Yeah, and I look at the testing model. We're up to 46,000 per day. You know, I think at some point we will be ramping up every day our capability to do more and more vaccinations. I don't know what that number is. We'll start out at a conservative goal and then steadily increase that.
So you said you've already administered 1,000 vaccines. You've got 3,200 for your department, correct?
3,400 firefighters.
3,400 firefighters. Okay, so, and are you on target to get them all done pretty quickly?
Yes, we are. Yeah, we've had 1,000 take the shot since Monday.
Okay. Thank you, sir.
You're welcome.
This one's coming in for Sean, if Sean's still here.
Okay.
Thank you, Sean. You said you had 500 volunteers currently working. How many testing sites are there?
There's, where are we at? 10 plus 5? Yeah, so it's 10 fixed sites and 5 mobile units.
Okay, and then you have a total of 500 volunteers at all those sites. Is that correct?
750.
750, okay. And then, do you need more volunteers? Is this something where, like, hospitals are experiencing shortages? Do you need more bodies at these locations?
Absolutely, and in particular, right now we're looking at clinicians because while principally with the LA Fire Department, also through Curative Lab, we have people. We need more people who can put needles in arms that are certified by the county and the state.
So presumably all of those testing sites will be vaccination sites, and your folks could be a part of that.
Yeah, we are all, I think, collaboratively have been looking at and planning to scale up once given the resources and the approval to do that. And we believe that we can do that not only in terms of just the numbers, but the specific targeting of those numbers, which we're able to do with our mobile sites very effectively, where we're going zip code to zip code in hot zones, and where there are those that are the most vulnerable, who have the least access to health insurance, etc. We know that with some of our sites, we have anywhere between 34 and 54% of uninsured patients. So we're hitting our targets. We know how to hit the targets, and we're very, our hands up to volunteer when the county gives us go to scale this up.
Finally, you've been out to these sites. I know you're out in the field a lot. What is the one thing you've learned in this past almost year now that you've been doing this for the city and county of LA? What is the one thing you've learned from this experience, and what would you tell others?
Well, I think it was the model that we set out with as a dream, but only came to fruition because of the great faith of the city of Los Angeles, and in particular Los Angeles Fire Department, that you can take civilian corps and merge them in partnerships. We take our lead from LA Fire, and we've been able to build these programs, evolve these programs together, and I think it has to do with basic citizen activism. The other thing I'd circle back to is that, as the mayor was referring to, where this community spread is happening, and what we have to really pay attention to is that we know there's been a kind of radicalization of libertarianism that has, as well as fatigue or lack of information education, that has led to a major population who is not been able to be or not being responsible to each other. I stand here today, somebody who's taking this very personally. My 93-year-old mother is 5 days into testing positive. Thank God, currently still asymptomatic. But there's none of us that aren't vulnerable. And now, especially as we have the end in sight, because of, science will make America great. And because of this end in sight, now is the time to really, really bond together as a country, as a core, and as we're doing here with LA Fire and Curative Lab and the other significant partners, USC, all, frankly, thanks to Mayor Garcetti.
Thank you, sir.
Yeah.
To the doctor from USC, pharmacist, if you could come up, please. We're getting some questions about the vaccine with respect to the new strain, the mutated strain. Do you have any knowledge about that, and what would you say?
I don't actually have any knowledge on this yet. I am not sure that there is a lot of data to support it. Right now, what I've heard is that they are expecting that this vaccine will be working on the variant strain, but we don't have the data yet.
Okay, so how many flu shots have you administered through this program?
15,000. Sorry, I didn't have the latest number.
15,000.
15,000.
Okay, and then I would ask you this then: are people anxious to get the flu shot, or are people hesitant to get the flu shot?
People are hesitant to get the flu shot. We've had people coming to get the flu shot, but people have been hesitant to get the flu shot as well. But we're still encouraging people to get both the flu shot and, when the COVID vaccine is available, to also get the COVID vaccine. They will have to be spaced, though, by 14 days. So now would be a great time to get your flu shot so that you're ready to get the COVID vaccine when it's your turn.
Thank you, Doctor. Finally, with you, Mr. Mayor. We're coming up on a year, and I wanted to know if you could rate the city's response. How would you rate the city's response? And also, looking back over this past year, if you could have changed anything with how this all rolled out, what would you have changed?
Well, I wouldn't rate the city's response in terms of city government. As proud as I am of city government, I rate our entire city's responses. I'm so proud of Los Angeles. I mean, I feel that every single day in the midst of the darkness of the death and loss and suffering. We were the first city to close down major points of gathering in America. The first city to then go to widespread testing, including asymptomatic, when people said don't do that. We were the first big city in America to mandate masks. We were the first city in America to erase the African American death rate that was double in this country for African Americans. And, you know, each step of the way, I think we've made good, sound decisions. Of course, all of us would go back, I think, in June and July. If we knew the moments that there'd be spikes, we would press doubly and triply into people to say, absolutely not. I don't know that we could have ever enforced our way out of that. I know that a lot of people think that, but as I said, 4 million people. All it takes, you know, if 95% of people are adhering to the rules with a virus that spreads this easily, it's still dangerous. When 80% do, it can be a freaking disaster. So I always have to counter everything that I say, because I do believe overwhelmingly. I mean, I just was with the head of the Red Cross here. She moved here from Florida. So through her eyes, she moved here, I think, a month or two ago. She said, I'm blown away by how many people wear masks in this city. You know, she's coming from a place where she said most people, or a lot of people, don't. But I'm blown away with how much people adhere to the protocols. But we've always been an extremely vulnerable city. That's what I think we didn't feel when we saved thousands of lives this summer, because we're the densest metropolitan area in America. New York metro area is 5th. We're the densest. Might not look it because we don't have skyscrapers, but where we think one family lives, 3 family lives, and it's 2 or 3 generations on top of each other. Some people who are vulnerable. If I could have changed one thing, I think I would have had national leadership that would have given us standards and would have depoliticized this. That's the one thing that to me was the most difficult part of this, is that this, as Sean was saying, became so political. Why is scientific advice or medical advice? I don't ask my doctor. I don't know what political party my doctor is, but when he gives me advice, I take it because he's a doctor and I'm not. And yet here we're going to, why is it that America is such an outlier and where our numbers are so high given the wealth, and that the World Health Organization said we are the best prepared country in the world for a pandemic? Being prepared and actually executing are 2 different things. It requires each one of us to own that and to do the right thing, and too many of us didn't. So, you know, if I could reverse one thing, it would be, of course, knowing July 4th, Thanksgiving, that these places, and I hope to God that that Christmas will not be another spike, and we better not make New Year's another spike, because those are the things that are killing people.
That's it on questions.
Okay.
Thanks, you, sir.
Thanks, Steve.
Happy New Year.
All right, you too. Thanks, everybody. Be safe. Appreciate it.